Ever woken up in a cold sweat, heart pounding, with the terrifying images of a nightmare still fresh in your mind? If so, you're not alone. Nightmares might be no fun, but they're surprisingly normal. In fact, about 85% of adults have them from time to time. They're especially common in kids. As one expert, Dr. Tiani, puts it, bedtime is a common time for our minds to wander to worrisome thoughts. It's quiet, it's dark, and there aren't many distractions. But what happens when, from time to time, becomes all the time? When nightmares are so frequent or upsetting that they disrupt your sleep and start affecting your daily life. Believe it or not, studies show that 1 in 20 people has a nightmare at least once a week. And for 2 to 8% of people in the US, it's even more serious. They experience something called nightmare disorder, where the dreams are so vivid and distressing that they genuinely impact their quality of life. Now, if you're going through a stressful period, it's pretty common to have more nightmares. The good news is, they usually fade away once the stressor is gone. But if your bad dreams stick around for weeks or even months, that's a sign you should probably chat with a healthcare provider. So, what's actually causing these midnight horror shows? Well, the obvious culprits are things like stress or watching a scary movie right before bed. But the list of potential causes is much longer and more complex than you might think. Let's dive into 7 common reasons you might be having nightmares. First up, a classic, scary entertainment. There is a very good reason your parents did not let you watch slasher flicks as a kid. They really can cause nightmares. Anything that triggers stress or anxiety can bring on bad dreams. So maybe think twice before diving into that true crime podcast or a creepy novel just before you turn out the lights. It's not just about movies either. Watching upsetting news, endlessly scrolling through social media, or even having a stressful conversation close to bedtime can all activate your nervous system and set the stage for a nightmare. Reason number 2, general life stress. If you're dealing with something big during the day, a move, a new job, a breakup, or the loss of a loved one, that stress doesn't just clock out when you go to bed. Unresolved problems and anxieties from our waking hours can easily cross over and fuel our nightmares. One theory is that our brain is trying to process or play out these unresolved feelings while we sleep. It's like our mind's way of trying to work through the stress, but the results can be pretty terrifying. Number 3 is a more serious condition, post-traumatic stress disorder, or PTSD. Nightmares are a hallmark symptom of PTSD, which can develop after experiencing a traumatic event that threatened your life or sense of safety. For people with PTSD, nightmares aren't just occasional. They're often recurrent, frequent, and incredibly vivid, usually relating back to the traumatic experience itself. An estimated 70 to 90% of people with PTSD experience these kinds of nightmares. If this sounds like you, please know that help is available. Talk therapy is the main treatment and can help you process distressing memories, which can lessen symptoms like nightmares and flashbacks. The 4th reason might be in your evening routine, alcohol and other substances. That glass of wine you think helps you unwind? It might be doing more harm than good. While alcohol can help you fall asleep faster, it wreaks havoc on your sleep cycle later in the night, especially your REM sleep. This can cause a REM rebound, which is strongly associated with an increase in nightmares. The same goes for caffeine. Having a coffee too close to bedtime can amp up your system and has been linked to more nightmare activity. Other substances, like stimulants, can also cause nightmares, particularly during withdrawal. Number 5 could be sitting in your medicine cabinet, certain medications. A surprising number of common medications list nightmares as a potential side effect. This includes some antidepressants, antipsychotics, beta blockers for high blood pressure, and even over-the-counter aids like melatonin and nicotine patches. Medications for Parkinson's disease and some popular injections for diabetes and obesity have also been linked to nightmares. This doesn't mean everyone who takes these will have bad dreams, but if you started a new medication and noticed an uptick in nightmares, it's worth discussing with your doctor. they might be able to adjust your dose or find an alternative. Reason number 6 is a big one: sleep deprivation. Not getting enough sleep is bad for your health in so many ways, from affecting your mood to increasing your risk for serious health conditions. And, as it turns out, being sleep deprived also makes you more likely to have nightmares. When you're exhausted and finally do get to sleep, your body tries to catch up on REM sleep, the stage where most dreams happen. This can lead to more intense and often more frightening dreams. So, prioritizing a consistent sleep schedule is a huge step in keeping nightmares at bay. And finally, number 7, untreated obstructive sleep apnea. This is a sleep disorder where your breathing repeatedly stops and starts throughout the night. This means your brain isn't getting enough oxygen, which has been strongly linked with nightmares. The scary part? The nightmares themselves can sometimes be about suffocation, choking, drowning, or being trapped in small spaces, directly reflecting the physical sensation of not being able to breathe properly. If you snore loudly, wake up gasping for air, or feel tired no matter how much you sleep, talk to a doctor about getting tested for sleep apnea. So, from stress and scary movies to medications and medical conditions, there are many potential triggers for nightmares. Understanding the cause is the first step toward finding a solution and getting back to peaceful, restorative sleep. If nightmares are a persistent problem for you, don't just suffer in silence. Talk to a doctor or a mental health professional. They can help you figure out what's going on and find the right path forward. Thanks for watching. We hope this was helpful. If you found this information useful, please give this video a thumbs up and don't forget to subscribe for more content to help you live a healthier, happier life. Sleep well. Sleep.